welcome to our virtual conference series. Our presenter today is Michelle Whitfield, and Michelle has been with PGCPS since 2004. She's previously worked in Maryland and Virginia and has taught at the elementary and middle and high school levels. She's a certified trainer for Responsibility Pathways and Crisis Prevention Institute, Nonviolent Crisis Intervention. She is also an adjunct professor for Notre Dame, Maryland University and Augustana College. And she's currently one of the PD facilitators for staff training on conducting functional behavior assessments and developing behavior intervention plans. She's the parent of a child identified with a learning disability and a child identified with attention deficit hyperactivity disorder, who have both successfully graduated from PGCPS. She also has 3 other children currently attending PGCPS, including a child receiving special education services at one of our regional centers. And with that, Michelle, I'm going to turn it over to you.
Good afternoon, everyone. Hopefully you are able to see my screen. Just to let you know that occasionally if I scroll down on the screen just to see the Zoom features for myself, to look at the chat, then a gray box will appear on the screen somewhere. That just means that I'm looking at the chat window at the time, but because it's not a part of the presentation, it doesn't show for you to be able to see it on my screen. You can still look at the chat window as a participant. So if you have any questions, I do encourage you to type them into the chat window. In addition to, you can just unmute your mic and ask the question, just so that you see what I'm talking about. You should see a gray box kind of in the middle of the screen. I will do my best to move it to the edges so that it does not interfere with the content that's on the screen, but that way it does help me monitor a bit in terms of if someone has a question, if there's someone's mic that I need to mute, you might see that little gray box come up. So to kind of get started, we are going to do an overview of the FBA BIP process for parents. So when FBA, meaning functional behavioral assessments, and BIP, behavior intervention plan. During the fall conference, and Marcy, are you still with us, Ms. Torchman?
I am. I'll be here the whole time.
Okay, thank you. Yep. So just to remind me, how long am I supposed to go? Just so I can gauge myself.
You're scheduled for an hour and 15 minutes.
Thank you. Gotcha.
Yep.
Okay. So during the fall conference this year in October, we were able to present this to some parents. So it was thought it would be a good idea to offer it again because the process for functional behavioral assessments and behavior intervention plans can be confusing to persons who maybe did not go to school to study behavior or behavior modification, so on and so forth. So we do try to at least clear it up a little bit for parents so that they understand what to expect if they have asked the school to initiate this process, or if the school has identified the fact that they would like to initiate this process. So we're going to click past the board members. In terms of our session objectives, we want you to walk away with an understanding of, kind of an overview of the FBA functional behavioral assessment process, an overview of the behavior intervention plan process, and then some tips for collaborating with the school team if you find that your child is going through this process. We'll start with a definition. Now, the actual definition of a functional behavioral assessment is the process of gathering information that reliably predicts the function, the conditions, and or the circumstances surrounding a student's behavior. So it is a process. Unlike some other assessments that a student may go through, it's not necessarily a one person sitting in the room with the student, asking them questions, recording the answers, and then scoring it and looking at a scale. the functional behavioral assessment is more of a process that involves that observation of your student, talking with you, talking with the colleagues in the school building, looking into the background, um, because we are trying to, as adults, figure out the motivation behind a student's behavior so that if we want to change that behavior, we're meeting the need that that problem behavior um, is used to get met. So, and I know that came out a little funny, so let me restate that. So whenever the student is displaying a behavior of concern to us, there's a reason behind it. They're getting a need met. And before we can decide that we want to change that behavior, we have to figure out what need is getting met by that behavior so that whatever behavior we try to teach them to display instead, that their need is still getting met. So the purpose of the FBA is to be a collaborative, student-centered problem-solving process. Remember, our goal is to change behavior. It is that process for us to try to figure out what those needs are. It is a process for us to decide which behaviors we are going to work on at one time. And it is also a process of getting a baseline or a starting point. If students are having difficulties with academics, then typically the teacher can do some type of probe or some type of questionnaire or some type of assessment to figure out, well, where are they performing now? Compare that to where their peers, their typically typical age peers are performing, and then we can shoot for what we want to be their growth. Same thing within behavior. We kind of have to figure out, well, how often are they displaying that behavior of concern now? How often are they displaying the behaviors that we prefer to see, and kind of set that baseline for, okay, here's the growth we want to make this year next time. In addition, at looking at, you know, this child may be doing a whole lot of things that the adults around them are unhappy with, but we can't target all of the behaviors at one time. We really have to have some discussion about, well, which ones are we going to target first, and how are we going to meet the needs of that child so that they don't have to display that behavior in the first place. The functional behavioral assessment form that we use is a form, and when I say we, I'm talking about Prince George's County Public Schools. The current form or document we use to record this functional behavioral assessment process is a document that was provided to us by the Maryland State Department of Education. And in that document, it has 5 parts. And you'll see the 5 parts listed there on the screen: student background information, behavioral definition, behavioral data, possible function, and then recommendations and goals. So when we're looking to try to figure out why this behavior continues, despite the fact that we've put things into place to support the child, we really have to dig into that part 1. That part 1 of the functional behavioral assessment, student background information, would be the longest part of the form, where we spend a whole lot of our time, because we really have to figure out what is going on around this child, what is going on in their background, what has gone on, what behaviors have been targeted, what have people tried, and we're really kind of doing that case study of that child before we even set the behaviors that we want to target, before we say, well, this is the baseline, or how much the child is displaying that behavior now. And that student background information is really going to weigh heavily in terms of us even trying to hypothesize what the function may be or what that need is. And then once we've hypothesized that function and we have our baseline, then we can make some recommendations and goals in terms of where we want the behavior to be, and maybe some recommendations for meeting that need to help that child in terms of function of their behavior. So I said a whole lot, but let's put a little bit of this into practice. I'm going to pause for just a second, and I see that there's something in the chat window, so I'm going to, oh, okay. Someone's asked if the session has started. They heard nothing.
Yeah, I answered that question, Michelle.
Okay, thank you, Marcy.
Might not have shown up.
Because you all are so quiet. I'm like, oh no, did my mic or something go out? Okay. So one thing, even though this is a webinar, and when we think about webinar, it is a web-based seminar. I don't like to just sit and talk to people. I want to get some discussion as well. So I'm going to show you a video. Prior to showing a video, I'll explain what's on the screen for you. And then I'll tell you what I want you to do after viewing the video. So on the screen, you should see a chart where it has obtain/gain on the left, avoid/escape on the right. Based on the way the Maryland State Department of Education's FBA form is set up, once we complete all of our discussion about student background information, about the behavior definition, and really targeting something that's observable and measurable, and we set our baseline of how much the child, or how often, or how many times the child is displaying that behavior of concern, then we hypothesize the function. So the way that Maryland has structured their form is that the student is either looking to get something, or the student is looking to get away from something. And then that something that they're either looking to obtain/gain or avoid/escape will fall into the realm of adult attention. So they're either looking to get it or get away from it, or get it or avoid it. Peer attention, they're either looking to obtain it or avoid it. Access to an object or an event, so they're either looking to be able to participate in some type of event or have an object, or they're looking to avoid participating in that event or being around that object. And then the fourth category will fall into sensory input. And typically with sensory input, we are talking about information that comes into our body through our five senses. In the chat window, because if you have access to the chat window, I am going to ask you to list out what are the five senses we were taught when we were young. So were those five things that we were taught? We have a sense of, and I'll give you a hint. Sense of sight was one. What were the others that we were taught when we were young? And I know this gray box is going crazy on the screen because I'm trying to view my chat window. There we go. Touch, smell, hearing, and taste. So we were taught about those five senses. Thank you. Touch, hearing, smell, and taste. And we were also taught about sight. So we were taught about those five senses when we were young. So that means, sensory input falls into the realm of information that comes into our body, either through what we see, what we feel, what we smell, what we hear, or what we taste. For any one that is here with us today that has had some background with our students with more significant disabilities, or our students with autism, we often hear about proprioceptive or vestibular senses as well. And I'm not an occupational therapist. They could tell you in depth all about vestibular and proprioceptive senses, but they have to do with your sense of orientation in time, in space, and the amount of pressure that is placed on your body. So if you've ever heard of a student maybe wearing a weighted vest, that's because they need some pressure on their body to help stabilize. If you've heard of a student rocking back and forth or spinning, that's because, their sense of their body space in general, they need to get some movement to help them stabilize. And I say those, and people typically look at our sensory input in reference to our students with autism, but it's not just about our students with autism. I am a very it's not aromophobic, because I'm not looking to get away from smells or anything like that, but aromatherapy, I love it. And that is some sensory input that I seek. I like the way that things smell. And if, you know, if you like to have a nice scented candle, that's because you want that sensory input coming in through your sense of smell. So when we talk about sensory input as a function, it's not just for our students with autism. So we have other students and just people in general who look to gain a certain sensory input or to avoid it. So keep that in mind. So just kind of looking at a brief of the functions that are available to us to discuss. We're either looking to get it or get away from one of these four things. So I am going to show a video, and what I'm going to ask you to do after watching the video is to discuss, what do you think the function of that little guy's behavior is? So I will tell you, it is a little guy in a video. There's going to be some crying. So if you have your computer up kind of loud, or there are people around you, just be prepared for the crying that's going to be on the video. And I know there's a couple second delay between me pressing play and for you actually seeing it. So that'll give me some time to skip this commercial. So now I'm going to ask you, what do you think the function of that little guy's behavior was? So if this is what we're choosing from, either looking to get something or get away from something, what do you feel like that baby was either trying to get or get away from? Obtain adults' attention. Thank you, Miss Jones. So yes, definitely. And that one we may say that that's an easy one. And typically when I'm training teachers, we start with this video and then we work our way up to something a little bit harder. But that one is a little very clean cut forward. The little guy, and we would have this discussion, would be that this little guy's behavior, he did more crying when he was in eyesight of the adults. When he could see them, then he cried. When they walked away, because it seems like they were using some planned ignoring, you could hear him get quiet because he didn't see them. But then when he did see them, he cried. And this happened, we saw him follow them and fall down and cry. This happened at least 4 or 5 times. So as a part of the functional behavioral assessment conversation, that's what we would be talking about. Well, when was the behavior more likely to occur? Well, it was more likely to occur in the presence of adults. When was it less likely to occur? It was less likely to occur when he couldn't see the adults. And what we have to understand and remember is that his crying and falling down is a strategy that he has learned to get his needs met. As a parent, you know that your babies cry when they need something when they're younger. That's their form of communication. I need to be picked up, I cry. I need to be fed, I cry. I need to be changed, then I may cry. So that's what this little guy has learned, gets his needs met. Well, he looks like he's about 2 or so, and maybe his parents are trying to now teach him, no, I need you to use some words or some other form of communication to get your needs met, and that the crying isn't going to work. So when we, as they move forward, we're trying to teach him to use some other form of way to get his needs met. They just have to make sure that they reinforce it as soon as he does it. If they know that he's doing it to get adult attention, then they have to make sure that they still give him that same adult attention once he displays the behavior that they want to see. So once we figured out what we think the function of the behavior is, then we move on to a behavior intervention plan in most cases. And I say most cases because a functional behavioral assessment may not always lead to a behavior intervention plan. It may be a situation where going through the process, the whole team realizes that maybe a 1 or 2 strategy fix will help, and they don't need the whole team to be on board. So as we look at this definition, and I'll clarify that statement about the whole team not being on board in just a minute. As we look at the definition of behavioral intervention plan, it is a proactive plan designed to address problem behaviors exhibited by a student in the educational setting through the use of positive behavioral intervention strategies and supports. And I do want to highlight that this is about the behaviors that happen in the educational setting, because the teachers can't, or the staff members can't necessarily change behaviors that occur in the home. There may be strategies and supports that they put in place for behaviors in the school that also impact what the parents experience at home, but that wouldn't be the primary reason for conducting a behavioral intervention plan. And when we talk about the whole team being on board, this is why, because the purpose of the behavior intervention plan is to align all of the staff together in order to implement strategies for teaching desired behaviors. And there are times that through the functional behavioral assessment and going through the background information and kind of trying to figure out what the function is, that we realize that maybe it's not a matter of that we need all staff on board for something, that we need a behavior intervention plan. We may need to just put this one support in place and we're good. Give you an example. I had a student who was diagnosed with childhood diabetes, and there were some significant behaviors of concern because his blood sugar was not being regulated. So in going through the process, that was something that was realized by the team. And instead of putting a behavior intervention plan in place, they ended up putting a health plan in place in reference to him going to the nurse, getting his blood sugar checked, and making sure that staff was monitoring what he ate when he was in school. So that's just an example of when we wouldn't go to a behavior intervention plan. But the majority of the time, we do end up going to a behavior intervention plan so we can get all staff on board with teaching the desired behaviors. It allows all staff to realize that these are the behaviors that we're targeting. These are the strategies that we're going to use to teach the new behaviors. And you'll see bullet number 2 is like a lesson plan for teaching behavior, and that's what it is. When we put academic interventions in place for students, there is a lesson plan, or there is a program, or there are at least specific strategies that the specialists say that this is how you're going to fill in this reading gap, or this is how you're going to fill in this math gap. Well, the behavior intervention plan is that plan for staff to fill in that behavior gap. Now, you'll see that in terms of the behavior intervention plan, there are 7 parts to this document. Again, this is a document from Maryland State Department of Education. If your child is seeing a behavior specialist outside of school, their plans are going to look a little different, because that's more of a clinical model designed for those specialists as opposed to the educational model. And this was designed by Maryland State Department of Education in collaboration with Johns Hopkins Center for Technology Education. And that was a mouthful. I apologize. So in terms of the process, it is developed after a functional behavioral assessment. Now, you may have schools that will put a behavior support plan in place, or they'll put a behavior reinforcement plan in place, or a behavior monitoring checklist or something in place. So there are ways that schools attempt to support and document behaviors in addition to intervene and address behaviors that aren't behavior intervention plans. But if the team decides that they want to do an official behavior intervention plan, then it should have started with a functional behavioral assessment first. The 7 parts, part 1 and part 2 come directly from the functional behavioral assessment. Part 1 is the student background information, is really the demographics of that child. Part 2, the summary statements, those appear at the end of a functional behavioral assessment because they kind of wrap up everything that was in that FBA. When an FBA is conducted, it does go into a student's limited access folder. Not everybody needs a copy of that functional behavioral assessment. The school would keep a copy in the student's limited access folder. The parent would get a copy of that document. What the staff members need would be the behavior intervention plan, because that's the lesson plan for teaching the behavior. So that summary statement in part 2 kind of summarizes what the FBA found without providing all of the sensitive personal information that may have been housed in that functional behavioral assessment. And then it has 3 types of strategies: prevention strategies, teaching strategies, and response strategies. And in the next slide or 2, we'll talk about them more in depth. Then part 6 is listed data collection. It is the plan for collecting data. So it lays out the plan that the team is going to take to collect data and to be able to monitor whether or not the child is making progress. And then part 7 lays out the implementation and the evaluation schedule for determining whether or not the student is making progress. So remember, again, I know it's a webinar. I'm supposed to be doing a seminar via the web, but I do have an activity in place. So in looking at the strategies in the behavior intervention plan, the strategies really should tie to something. We're not just pulling strategies out of a book. We're not just pulling a strategy we heard about. It really should be tied to something from the functional behavioral assessment so that we are targeting and heading in the right direction. So what you'll see on the chart, you'll see the type of strategy, because there are 3 different types. So for every behavior we target, we need to have each of these 3 different types of strategies built in for that behavior. Our prevention strategies are tied to the function. So if we identify that that child wants adult attention as a way of preventing the problem behavior, whatever problem behavior it is, we're not even talking about that yet because we're in prevention mode. We're being proactive. So in order to try to prevent the problem behavior, we need to come up with a way to give that child that adult attention. If that's the function, if that's what we've identified, that's what they need, we as a team need to come up, well, how are we going to give it to them? So again, I'm going to ask you to either unmute your mic or to go to the chat window. What would be a way of giving a student adult attention so that they don't have to misbehave to get it? How could we give a child adult attention in school in a positive way? Because right now we're being all positive. We're not talking about the problem behavior. But what would be a positive way of giving a student some adult attention? I'd like to give wait time before I start talking. So I'll give it about 30 more seconds, and then I'll give you some examples. A reward for being good, positive feedback, when the student demonstrates the desired behavior. Definitely. So again, we're talking about the just the need. We identified the function was planned activity or time with preferred adult. Very good. We're talking recognize and pre-warn. Okay. See, I started talking too quick. Your brains are warming up now and you're sharing. Thank you. Greet student by name as they enter the classroom. Miss Williams, I'm reading yours. Hold on just a minute. Let the student know you are happy they are in the classroom. Definitely. All of those are very good suggestions. It's all about giving them that positive adult attention without them having to do anything to get it, so that we are trying to meet that need. Greeting them by name, telling them you're glad you're there, doing check-ins with them even before there's any trouble, having that preferred adult that they could go to, that the team is looking at ways of how can we give this child adult attention that is unconditional. So even if I am not having such a bad day, not having such a good day, if we've built in the fact that I'm going to get adult attention, say first thing in the morning, every morning, then that needs to be in there. In addition to, and I'm glad somebody brought it up, in addition to giving them some more when they show that desired behavior that we want to see, because we need to reinforce it. If we want that behavior, that desired behavior, to replace the problem behavior, we have to reinforce it. And that's where the teaching strategies come in terms of how we reinforce the behavior that we want to see. If the skill that we want to reinforce is asking for help, then we have to talk about, well, how are we going to reinforce that they're asking for help? And so when someone mentioned, giving them positive feedback when they demonstrate their desired behavior. So when the young person asks for help, we're going to say, thank you for using your words. Thank you for asking for help. Yes, I'll be there in 1 minute. So that we want to make sure that we do reinforce that skill over and over and over again, because that's what's going to help it become the main strategy that the student will go to get their need met, instead of defaulting on that problem behavior. In addition, what another thing or another support that could be listed under the teaching strategies, in addition to the reinforcement, is how the staff will teach them. Are we going to have a class discussion about asking for help? Are we going to build it into our norms? How are we going to teach the skill to start? How are we going to reinforce the skill when they display it? And then what other supports can we give them in the midst of the teaching? So if we said that we're going to give them a pass to go see their preferred adult, then we have to talk about the fact that we're going to have passes for them to go see their preferred adult. So teaching strategies will have a lot in it, because we have to talk about how we're going to teach it, what we're going to give the staff in order to teach it, and then how we're going to reinforce the skill when we see it. The last type of strategy that is built into the form in the document that we're using would be the response strategy. The response strategy means when the child displays that problem behavior, because they will, it's not going to go away right away because a behavior intervention plan has been put on paper, unless it's magic paper, and I haven't found any of that magic paper yet. We have to be prepared for the fact that the child is going to display that problem behavior until they learn to replace it with the desired behavior that we're working on through the teaching strategies. So the team has to come up with, well, how are we going to respond? We don't want to reinforce it. If we know that they're screaming to get adult attention, we have to make sure that we don't go overboard with giving them adult attention when they start screaming, because if we do, then we've just reinforced the screaming when we're trying to extinguish it. So in the video of the parents with the young man, we saw that they were using planned ignoring. They had, I don't know, I'm assuming, and I'm going to think positively, that they decided as a parent team, along with their dog, that they were going to ignore the crying baby and walk past that young man, which they did. in order for that to be effective, they would have also had to pair that with the reinforcement in terms of the teaching, and then finding ways to give him positive attention before any crying occurs with the prevention. But it's the thought that we're agreeing as a team, this is how we're going to respond because we don't want to make it worse. And we're also recognizing and saying that this is a behavior we said that we're working on. The process can take a while. The process at times, parents may want to, or we as parents, and I say we as parents because I've dealt with my fair share of behavior of my children at school. Sometimes we don't want to be a part of that discussion, because we don't like the fact that our children are behaving in a way that is upsetting to others. They may be behaving in a way that's upsetting to us when they're with us at home. We may not have the answers that the team is looking for. We don't have the fix. If we had the fix, then the child wouldn't be displaying that behavior in the first place. But not having the fix doesn't mean that you don't participate in the process. And by participating in the process, it also helps you get input and get support with the behaviors that you may be seeing at home as well. So what I want to do is to go over some tips for participating in this process, because the end outcome is a child who has social skills and a child that is displaying behaviors that were taught and that were reinforced. And as I tell my children, you know, please know how to act in public, and then we'll deal with everything else at home. We want our children displaying those behaviors, so collaborating can only help the situation. So my first tip is sharing background information. It is hard for a school team that may or may not know your child to know everything about your child that you know. You know more about your child than they do. So if there's some school history that predates that school,
historia en la
share.
escuela.
If there is school history that predates that school, please share. If there are previous behaviors that maybe another team dealt with, talk about that and share that. Well, he used to do ABC, but now he does DEF. He used to bite people, now he just waves his hands. Share what it was, if there are some previous behaviors. If there were behaviors that you were concerned about in the past, or behaviors that you're seeing at home that they may or may not see in school, then share that information. Any medical information, share that, because it could be that it is the behavior that the staff is seeing is a side effect of a medication they may be taking. I shared the example of the young man who had diabetes. That would have only been known had the parents shared that information and got that the doctor to fill out the form. Share the family dynamics. Now, in the actual form, it says family concerns, but they're not really asking for, mom, Ms. Whitfield, what are you concerned about? What they're looking for are the family dynamics, because there are some times that the dynamics within the household may help to contribute to some behaviors that are seeing in school. Now, that's kind of hard to hear for some of our parents, but it's not all about that your household is bad. That's not what that is. It could be that it could be something that is a joyous occasion for an adult, but it will impact the child. For example, a new baby in a house. You may think, hey, that's a wonderful thing. It's a baby. The baby is bouncy, healthy little boy. But if your next youngest child is 14 years old, that 14-year-old may feel some kind of way about a new baby being in the house. Again, it's not that it's a bad thing, but it could be impacting their behavior. And those are the type of things we want to share. New marriages, divorces, new moves, an anniversary of the death of a loved one. So we really do have to make sure that we're not holding on to information just because, when it could help, because you're asking, either we as the parent are asking or the school team is looking to try to figure out what's going on with this child and is motivating the behaviors. And if we don't have all of the pieces to the puzzle, it's really hard to figure out. And then any of your child's strengths and interests that the school team may not know about, because it may not be tied to academics. We want to make sure that we're sharing that as well, because that will help when we start looking to reinforce your child. Again, how we may start looking at their interests. Your child could have a really big interest in being a writer one day, and the school team may not know that, and that may be something that's going on with that behavior that is related to writing. It may be why they won't put down that pen and paper when the teacher is asking them to do something else, because your child is journaling. So those are things that we may want, that as parents we want to share. Tip 2, share the strategies you use. So what are the strategies you use at home with your child? What are the things that you do to be preventative? I sat in a BIP meeting, maybe this time last year, and the parents shared that they do yoga in the morning to try to get her child calm and centered before she sends them to school. So the mom started sharing with us the different things that she was doing at home to support her son. Because then those were things that the school team could build upon if they, once they knew that, hey, he's doing yoga and calming strategies at home. When he comes in the morning, we may just need to give him some more time to now do that transition, so he's able to continue with what mom started at home. Talk about the way that you reinforce or reward your child at home, or how you would prefer the school team reward or not reward. So that is something that is a part of that BIP. It has a section for how the parent will be involved. So if you're going to do a certain reward at home, you can work with the school team and say, hey, you just give me the information and I'll reward them, so that you don't have to come out of pocket to do so. So you're sharing that information. You're sharing your thoughts on discipline and responses to certain behaviors, or what part you would like to play. Because if one of the strategies that the school team uses is to call you, well, then you may want to say, well, what part of that process or for which behaviors you want to be called. So that is not everything, and that calling you is not the first strategy the staff member uses. Talk to them about which behaviors you are focusing on. During this time of distance learning, I know my son's teacher and I had a conversation about the skills that I wanted to focus on right now. Yes, I know you're sending certain things home, but these are the skills that we're going to focus on here in the home, since he's home with me all day. So, have that discussion, because the behaviors the school team may want to focus on may not be the same ones you're focusing on, but you all could talk about that. And then again, you share how you want to be involved with this process. And the third tip, please participate in the process. If at all possible, read the documents that are sent home ahead of time, so that you come with questions or comments. And I'm not sure where you got this from, or you may need to know this. Come with those things that you want to share. The forms that we're currently using can look very confusing. So circle things that you don't understand and ask for clarifications, so that you're getting your needs as a parent met for information. Seek advice from those who may know more. So if you have a family member, if you have a neighbor, if you have someone close to you, or someone you've seen an advertisement for that may just know a little bit more than you, then you can ask them if they could help you either explain it to you outside the meeting, or attend the meeting with you, as in terms of being a support for you for information. Not necessarily, it's not about a fight with the school. We're looking to collaborate, but If you need some support in the meeting because you don't know, then bring somebody with you. It could be a family member that provides the majority of the oversight or care for your child outside of school because you're working. Involve those persons and caregivers, because then they could speak more to some of the behaviors that they're seeing as well. Because our children do act differently when they're not with us. Um, I have five. All five of them act differently when they're not with their mommy or their daddy, or they act differently with mommy than they act differently than what they act with daddy. So, you know, there are other people that are close to you outside of school that may have some insight on behavior as well. And provide input as a part of the team. So if you can attend physically, please do so. If you can attend via phone, please do so. If you can attend virtually through the Zoom, please do so. And if you can't attend any of those ways, then write an email or write down your input and send it to the team so that it can be a part of the record, whether or not you can be there. And then if you don't do any of that and you get the documents home and still have a question, call somebody. Typically, all of the documents that come home from Prince George's County Public Schools has a phone number somewhere. If nothing else, on the prior written notice, I think it has a phone number of someone you can call to get additional information. So if you couldn't be a part of that, those meetings, please make the phone call and let them know that you're here. I need information. Tell me what's going on. So I do want you to take a look at this chart that's in front of you, because as a part of this process, the BIP process, then we're supposed to come back to the table on these behaviors and discuss the data that's being collected to determine whether or not the child is making progress. I'd like to draw parallels to other academic skills very often, due to the fact it's very easy for us to come back to the table on the data and talk about how a child is progressing or not progressing, say with their reading level. Because if they took a reading test and several of the reading tests say that they're at a third grade level, and then we come back a year later and they're at the fifth grade level, then we can say, hey, they made progress. Well, we need to do the same thing with behavior, because if a problem behavior is there, the adults that are interacting with that child, their emotions get tapped into sometimes in reference to that behavior. So it's hard for us to see objectively that the child really is doing better if the child is still displaying the behaviors at times. So it helps for us to look at the data. So hopefully you've had a chance to look at the chart that's on the screen. So if you're looking in the far left column, the behaviors that were identified for us to discuss and address the behavior intervention plan was hits and punches was one behavior. So he was striking his peers. Another behavior was elopes. The child was leaving his assigned location. And then the third behavior was makes disrespectful comments, and that is according to the teachers, the staff members who were a part of this team originally. The baseline for behavior. So when they started the behavior intervention plan, this is how often or how long the child was displaying these behaviors. So they were saying he was striking his peers 2 to 3 times per month, and on average it would last about 45 minutes. He was eloping 1 to 2 days, 1 to 2 times per day. So 1 to 2 times per day, he was leaving his assigned location, and he was making disrespectful comments 3 to 4 times per day. When we came back to the table in 2019, based on the information we had, based on the school's behavior charts that they were doing daily, based on the suspension records that we had, the student's current rate was 1 time per month he was striking his peers. On average, 1 time per month he was leaving his assigned location, and 2 times per month it was noted that he was making disrespectful comments. So looking at that data, and you can either unmute your mic or use your chat window, what did that child make progress with these behaviors? And I'm quiet because I'm letting you think and answer. And I have a couple yeses. He did. And when when I first joined this team and sat down, um, there was some disagreement amongst the group in terms of whether or not the child was making progress. So we ended up having to, well, let's really pull these numbers and see, and let's do a comparison. This is where he was in 2018. This is what the documentation says now. So it was kind of undeniable at that point. The numbers spoke to what the numbers spoke to, and the team was able to say, okay, yes, he did make some progress. Yes, he did get in a fight, and yes, he did get suspended, but compared to what he was doing last year this time, he has made progress. And that's what we have to do when we start looking at behaviors. We really have to start to look at the numbers so that our feelings about the behavior don't get in the way, because no one likes a child who's displaying, let me take that back, nobody likes the behavior that child is displaying when they're displaying behaviors of concern, but we do love the child and we want the child to do better. So it helps for us to see the numbers so that everyone involved knows and can say, yes, he is doing better. Now let's keep working at it to get him to where we want him to be. Are there any questions? And Ms. Torchman, I'm not sure how you plan to do the question and answer phase. Okay.
We can do it one of two ways. You can continue to have through the chat, or we can have folks unmute themselves. It's entirely up to you.
Okay. So there is time set aside for questions. I would say I'll give it a couple more minutes in case you have a question. I know we have a breakout room with interpreters going on, so I do want to give them time in case they have a question.
All right, Michelle, I'm thinking we don't have any questions.
Okay, so I did want to give my contact information. You'll see Mr. Dent that's listed there. He is my colleague that typically trains with me.